So cases still going down in the United Kingdom, more on that in a minute, and in the United States, and Canada is flattish. But we are still concerned about Canada and the United States because these are European countries here. Czech Republic, very high number of cases. Hungary, Italy and Poland, Germany all going up as a result of spread of new variants, which of course is one of our major concerns and has caused all sorts of problems, as we know, in the UK. Welcome to this talk. It's Monday the 8th of March. We're going to finish off with a special report on Australia, and we'll be having some interesting news from the Czech Republic and Slovakia as well. But before that, let's just check on the situation in the UK. So, number of cases, this is the prevalence here, it's going down really quite nicely. But still 6,224 new cases in the day. And as we see, 120,000 people currently symptomatic in the UK. So this is not gone away by any means. This is still with us, although cases are going down nicely. Now, of course, schools are opening again in the UK today. Like all the schools, all of a sudden, they're just opening. This will cause an increase in cases. There is no question about that. And of course, large swathes of our population are currently unprotected from the virus. Most under 60s have not been vaccinated. 50 to 60-year-old age group just starting to be vaccinated now. And these people are still vulnerable to some degree, or to a fair degree, to severe COVID-19 hospitalisation and indeed death. So there will be more cases. That is inevitable because the schools are now opening. That will cause some more severe cases, albeit, of course, with the usual 3-4 week delay. Let's just hope that the increase in cases is not a dramatic increase in cases. So dropping new COVID cases resume. So it kind of staggered a bit, but now it's going down again. So if we look at that, so we've just checked that number there actually. We saw the number of new cases in the last 24 hours was 6,242. So that's good, that's lower. Because the week before, symptomatic cases were averaging 8,111. And that was based on nearly 10,000 swab tests on the COVID Symptom Tracker app. So we see down to 6,242 from 8,011. So it's a good reduction. The week before that, 2 weeks ago, it was 9,500 new cases a day. So there's a decrease of 15% there from the past week. And the decrease is 88% from the peak of 69,000 at roughly the 1st of January, I think the peak was, wasn't it? And the current prevalence for symptomatic people is 1 in 483. The real incidence being slightly higher because this is just counting the symptomatic cases, and there will be asymptomatic cases as well. And if we just look at the official government data, very similar numbers there. Cases 5,177, down 31% on the week. Deaths, still people dying, but nevertheless down 34.8% on the week. Still people getting hospitalised, but down 29.6%. But remember, there's well over 12,000, nearly 13,000 people in hospital still. And this is causing pressure on the health service still in some areas. Where I live, it's not bad at all. Other areas, it's more difficult. So it does depend a bit on the area. Vaccinations, the first dose over 22 million, second dose 1.22 million. So vaccination programme in the UK still going well. And the only other news to report on today from the UK that I'm going to mention is some ludicrous behaviour in Scotland after the football. People seem to regress to some sort of bizarre tribal type of behaviour. It really is quite strange. And Nicola Sturgeon is absolutely livid. So mass gatherings, drinking, non-mask wearing, singing, celebrating, all this stuff that seems to go with it. Everyone's made so many sacrifices in the past year, and seeing a minority risk our progress is infuriating and disgraceful. Now, I don't agree with Miss Sturgeon on everything, but I certainly agree with her on that. So, as we've said, the schools in the UK are opening today. Now, this is the, whatever you want to call it, the roadmap, the plan out of the pandemic. And just to remind ourselves of this, I'm going to paste the whole thing in the description so you can be updated of it. But these events are happening 5 weeks apart. So the first one today is the 8th of March. All schools and colleges opening today. Wham, bam, everything opening all at once. And you can meet outside with 2 people for a cup of tea or a picnic, which is nice. And then the second part of step 1 is happening on the 29th of March. Now, between the 8th of March and the 29th of March, of course, is only 3 weeks. Not enough time to work out what trends are happening. But then there's going to be outdoor gatherings, 6 people or 2 households, including private gardens, and outdoor sports are going to be allowed. So this is really part A and part B of step 1. And then step 2 will be on the 12th of April. Now, we've been through these before, so I'm not going to go through them all in detail, but we will keep them, and I've posted it all below for your perusal. So we're opening step 1 now, and as we've said, it will mean cases will go up. It is utterly inevitable, I am afraid. Now, the United States, cases and deaths, well over 500,000 deaths in the United States. Let's just take a look at some trends in the States at the moment. There we go. So here's the number of cases. So going down really, so this is trends in the number of COVID-19 cases and deaths reported in the United States. So here we see the cases going down, but having flattened off a bit. So 7-day moving average, still 60,000 new cases a day, more than over the past sort of 7 days, although that data is slightly out of date. And deaths in the United States, unfortunately, still remaining pretty high. Also in the States, interesting to look at the hospitalisations, which are going down. So encouraging to see that go down, 18.3% reduction in the past 7 days. And the other thing from the States that we are keeping an eye on is the spread of the variants of concern. Now, I must say this data is remarkably disappointing. It's out of date and it's so patchy. I'm really questioning whether it's worth sharing it. But given that I am showing it, B117 UK variant, are we really to believe there's only 3,000 cases in the United States? South Africa variant, even less well known. Brazilian variant, even less well known than that, but only 15 cases reported. Really very poor level of very poor level of genomic surveillance from the United States. So that's that data there. Check it out. Now, vaccinations, on the other hand, in the States are going really quite well. So over 90,000 doses administered. 90 million doses administered, and quite a lot of doses waiting to be administered. 59 million have had the first dose, representing 17.7% of the total US population, of course, not yet vaccinating under 18s. Second dose, over 30 million have been given, 9.2% of the whole population. But the question is, what does this vaccination mean in terms of behaviour? Well, at the moment it shouldn't mean anything, but that's currently being debated. And there should be an announcement on that fairly soon from the States. So Dr. Fauci said those guidelines are coming out from the CDC really imminently. What will vaccinated people be allowed to do? We don't know yet. And Dr. Rochelle Walensky, director of the CDC, of course. These are complex issues and the science is rapidly evolving. We are making sure, taking our time to get this right. So we don't quite know yet, but we are expecting an announcement this week. Will there be liberalisation of the rules for people that have been vaccinated in the States? I am expecting so. Now, Czech Republic, this is interesting. And it's related to the ivermectin story we've been looking at over the past couple of days. Czech Republic, in order to protect public health, they are saying, to ensure the availability of medical products important for the provision of health. These are direct quotes from the Czech Republic government website. Check it out for yourself. And there is an English version as well. And I checked this with Google Translate. It is accurate. So they're using this drug here, 3 milligram tablets, which is ivermectin, manufactured, I believe, in fact, definitely manufactured in Bulgaria, contains the active substance ivermectin. subject to a medical prescription. In other words, doctors in the Czech Republic can now prescribe ivermectin for SARS coronavirus 2. Only for use in hospitalised patients and over 18 years of age, but it can be GPs or hospitalised patients can get it. Not to be given to pregnant women according to the Czech Republic guidelines. Teratogenicity means potential damage to the unborn baby. Now, I'm not going to go into fetal damage at the moment, but I'm merely reporting what the Czech Republic is saying. And they're going for the lower dose, 200 micrograms, which is 0.2 milligrams per kilogram per day, administered on days 1, 3 and 5 of the infection. So there you go, Czech Republic authorising its doctors to prescribe ivermectin for COVID-19. Maximum daily dose of 24 milligrams is evaluated as safe and most appropriate. Obviously, this is not me giving you advice. This is me merely reporting what the Czech authorities say. Never take anything because you've heard me say it. We do not prescribe. Go to your own doctor for that. But that's what they're saying in the Czech Republic. Can be given to inpatient healthcare providers. In other words, they're talking about giving it to nurses and doctors as a prophylaxis there. So interesting. Due to the favourable safety profile and lack of other treatment alternatives, they say it's more appropriate to allow the use of unregistered medicinal products under controlled conditions. But they are giving it short-term licence. They say thus preventing reckless use of ivermectin obtained on the black market or by using inappropriate veterinary products such as doses or such as foams, creams, pastes, where you can't work out the dose is what that is saying. So pretty frightening that people have been taking this drug from veterinary products. And of course, as we've said repeatedly, go to your own doctor, take nothing your own prescriber has not prescribed. The patient must be informed that she is being treated with an unregistered medical product, that it is not in accordance with the maker's authorisations and will be aware of its benefits and risks. So this is not what the manufacturers are recommending it for. It's recommended for parasitic infections. But here's the Czech Republic giving it temporary authorisation. 6 months, I believe, it's giving it. And its neighbours Slovakia going the same way. Authorised ivermectin for use against COVID-19 in hospital and on prescription for the next 6 months. So do check out those websites for yourself. Here we have 2 European countries, both authorising its clinicians to prescribe ivermectin for COVID-19. Interesting. Now, just a quick review of some other countries. Afghanistan. Who knows how many cases there's been in Afghanistan? The data is so unreliable, we've no idea. But population is 38 million. They've just received under 500,000 from COVAX. That's on top of the million from India so far. So that means they've got 1 million vaccines now for 38 million people. That just sort of gives an idea of the magnitude of the job still to be done. Now, New Zealand seems to be going down the Pfizer route, bought 10 million Pfizer vaccine doses. It's the only vaccine approved so far, but they don't seem to be starting vaccinating till the middle of their winter time, the middle of our summertime, the middle of the year. So going down the Pfizer route, okay, fair enough, but why the delay? Not really quite sure why they're not doing things faster in New Zealand. You'd think they'd want to get things going, but that seems to be what's happening. Vietnam, now the cases in these numbers from Vietnam we believe to be underestimates, but not by a lot. So very, very few cases in Vietnam, very, very few deaths. Very successful non-pharmaceutical interventions in Vietnam. They have done well. Not this well, but they've done well. And they began their immunisation programme today, and they're using the Oxford AstraZeneca vaccine. So that's their V-Day in Vietnam. South Korea is not yet done, but today I'm expecting South Korea to approve the Oxford AstraZeneca vaccine for the over 65s, following France and Germany and other European countries. Now, of course, we need to spare a thought for the people in Syria. I've forgotten to put the population down, but cases I think that number's wrong. I think the cases there should be 15,981 reported cases in Syria. Deaths 1,063. Now, these figures are clearly wrong. We basically don't have any testing data or data from Syria, so we don't know. But we do believe that the Syrian people have been suffering badly, particularly as a lot of them are living under very difficult conditions at the moment. And if anyone's interested, President Bashar al-Assad, sorry, I read him, that's not a deliberate mistake, al-Assad, and Assam, his British-born wife, both tested positive, mildly symptomatic, quarantining at home for 2 weeks, just in case anyone wanted to know that. Right, now let's go on to listen to Dr. Susan Oliver, who's a research scientist from, sorry Susan, I've forgotten, I know it's Australia. I'm pretty sure, is it Sydney? Apologies if it's wrong. Anyway, a report on the vaccines, I believe, so I'm looking forward to this.
Hello, my name's Susan, and I'm going to give you a report on what's happening with COVID and the vaccine in Australia. And I'm from Sydney in Australia, which is the capital of New South Wales. And New South Wales is the most populous state in Australia. And we are also the state that is bringing in the vast majority of passengers who require quarantining. And for those who don't know, in Australia, our international borders are closed and have been since the start of the pandemic, which means if you live in Australia, you cannot go overseas unless you get an exemption. And the only people, with a few exceptions, who can come to Australia are people who are either Australian citizens or permanent residents. And when they arrive, they have to go into 2 weeks mandatory hotel quarantine at their expense. Now, this is great because it, keeps Australia safe. But of course, the risk isn't none because, of course, and there's been well publicised, the virus does occasionally escape from quarantine. And so we are very excited in Australia that we are now getting vaccinated, and some of the first to be vaccinated are actually the quarantine workers. And in terms of the vaccines, so far there have been 81,000 people vaccinated in Australia. It's fairly a low number at the moment, but they will be ramping up. And in fact, on Monday, we will be starting the rollout of the AstraZeneca vaccine. And that is great because, of course, the AstraZeneca vaccine is much easier to handle because it can be kept at fridge temperatures. And also something that people don't mention very often is, and correct me if I'm wrong on this, but I don't believe it needs to be diluted. It is a multi-dose vaccine, but it is basically used in the vial that it's supplied in, so you don't need to dilute it before it's used. So that also makes it good. Now, you would have heard, and Dr. John has already mentioned it, that the Italians have decided to block further deliveries of the vaccine to Australia. And now the French are saying, yeah, that's a good idea. We're going to do that too. And they think the reason for this is because Australia's in a better position than what they are. I agree we are, but it's not an accident that we're in a better position. We're in a better position because we have, as a nation, we have made a lot of sacrifices to make sure that we actually keep the virus out of our country. And when it does get in, we go into major lockdown to get it back under control. So perhaps if the Italians and the French had tried the same thing, maybe they would also be in a good position. I won't say any more on that. But I will also mention, even though at the moment we have 0 cases of transmission in the community, we still do have restrictions because we understand how dangerous this virus can be, and we know that it needs to be kept out of the community. As an example, in New South Wales where I live, the last local infection we had was 45 days ago. But masks are still mandatory on public transport, and I'll just show you my collection of masks. I've got quite a few of them, and basically this is the one that matches my outfit today, but I have a mask to match every outfit. And the vast majority of people in New South Wales anyway are complying with the rules, and it is mandatory, it's not optional, to wear a mask on public transport. We also have limits to the number of people who can attend venues. It's not more than 1 person per 2 square metres. If you are attending a venue, you need to check in with a QR code. That is so if it turns out someone who was at the venue does end up being infected, everyone who was there with them can be easily traced, and they will then go into mandatory 14 days self-isolation. And we also have some venues like nightclubs, high-risk venues, that remain closed. So yes, we don't have any virus at the moment, but we are making sacrifices to keep it that way. But as I say, back to the good news. From Monday, we will be rolling out the AstraZeneca vaccine, and from the 22nd of March, we will be rolling out our locally produced AstraZeneca vaccine. That will vastly increase the number of vaccines that are available. And at the same time as the local vaccine rollout begins, we will also start to roll it out through general practices. So there'll be much more places in Australia where you can actually get the vaccine. And that will also be the start of the phase 1B rollout, which is basically includes all Australians above the age of 70. At the moment, it's frontline workers in quarantine and also nursing home residents. But from the 22nd, it will be all Australians above 70, which I'm very excited about. No, I'm not over 70 myself, but my parents are both 80. So I'm really excited about that. And I've just realised I've now gone over my 5-minute limit. So I will say goodbye and please stay safe, everyone.
Susan, what a fantastic report.
I'm going to give you a report on what's happening.
Absolutely brilliant. Really, really interesting. I must say I hadn't heard that France had blocked exports to vaccines to Australia. That really is quite significant. And we agree, Australia has done spectacularly well, but not at no cost. It's been at a high cost. And I think the world admires the Australian response. So great report, Susan. Really appreciate that. Thank you very much. And hopefully Susan will keep us updated. So here we have Heidi and her sister, who've just been vaccinated. They are from Virginia. So that is good to see. Thank you for keeping us updated. And this is Dr. Johnny from the Philippines. And he's given us reports before, so good to see that he's being vaccinated. So that's us for today. Thank you, of course, for watching. And yep, that's it. That's all I want to say. Thank you for watching. That's us for today.